Good morning, all of you. I am Mahendra Saini, Assistant Professor, Department of Pharmacy, Suresh Gyan Vihar University. Today I will discuss about the subject of pathophysiology and topic endocrine system, thyroid gland. Thyroid gland. Learning objectives. Learning objectives of thyroid gland disorders. Based on Based on the content in this chapter, the reader should be able to journal aspects of thyroid gland, classification of thyroid gland disorders, goiter, Graves' disease, cretisme, myxoedema, has Hashimoto disease. These are the learning objectives of thyroid disorders. Next one, learning outcomes. Learning outcomes by the end of the lecture. The student should be able to understand, first of all, general aspects of thyroid gland, classification of thyroid gland disorders, goiter, Graves' disease, cretisme, myxoedema, Hashimoto disease. Hashimoto disease. These are the learning outcomes of thyroid disorders. First of all, journal aspects of thyroid gland. Journal aspects of thyroid gland. First of all, anatomy. Weight range from 12 to 30 gram. Weight range of thyroid gland is 12 to 30 gram. Located in the neck anterior to the trachea. The situation located thyroid gland in the neck and anterior to the trachea. Produce T3 and T4 active hormones. Thyroid gland produce the T4 and T3 active hormones that are the thyroid hormones. T4 means thyroxine and tetraiodothyronine, and T3 means triiodothyronine. These are the thyroid gland hormones. Thyroid gland use of iodine for making two hormones. First one is triiodothyronine and second one is thyroxine, also known as tetraiodothyronine. These are the journal aspects of thyroid gland. Thyroid gland regulation negative feedback mechanism axis. First of all, hypothyroid negative feedback axis. Thyroid negative feedback mechanism is a scene in control of thyroid hormone secretions. When blood concentration of thyroid hormone increase above a certain thresholds, thyroid releasing hormone secreting neurons in the hypothalamus are inhibited and stop secreting thyroid releasing hormone. This is example of negative feedback mechanism. Maintain the thyroid releasing hormone by the hypothalamus, and normal range of thyroid hormone in adults 0.5 to 4.1 mu per liter, milli unit per liter. Hypothalamus, hypothalamus and hypothalamus release the thyroid releasing hormone. Then thyroid releasing hormone release the pituitary gland. Thyroid releasing hormone act on pituitary gland. Then pituitary gland release the thyroid stimulating hormone, and thyroid stimulating hormone release the act on the thyroid gland, and thyroid gland release the T3 and T4. T3 means triiodothyronine and T4 means thyroxine, tetraiodothyronine. This is the negative feedback mechanism of thyroid gland. Thyroid disorders may be classified as thyroid disorders may be classified as hypothyroidism. Hypothyroidism means thyrotoxicosis. Thyrotoxicosis. Hypothyroidism means thyrotoxicosis. Overproduction of thyroid hormone. Overproduction of thyroid hormone. High thyroid stimulating hormone levels means thyroid is not making enough thyroid hormone. A condition are called hypothyroidism. And low thyroid stimulating level means overactive thyroid production, also known as hyperthyroidism. And lethargy characterized by lesser and less of energy. Hypothyroidism means gland destructions and underproduction of thyroid hormone. These are the thyroid disorders may be classified as. First of all, thyroid stimulating hormone highly usually means hypothyroidism and rarely causes thyroid stimulating hormone secreting pituitary tumors and thyroid hormone resistance. And thyroid stimulating hormone low usually means hyperthyroidism and other causes first trimester of pregnancy, after treatment of hyperthyroidism, and some medications, steroids, dopamine. These are the conditions in the thyroid stimulating hormone low and means hyperthyroidism. Thyroid gland disorders. Thyroid gland disorders like goiter, Graves' disease, cretinism, myxoedema, Hashimoto disease. These are the many diseases under the thyroid gland disorders. First of all, discuss about the goiter. First of all, discuss about the goiter. A goiter is a swelling of the neck. Goiter is a swelling of the neck. In which goiter? Swelling of the neck or the larynx resulting from the enlargement of thyroid gland. In which goiter? Enlargement of thyroid gland, also known as thyromegalia. Thyromegalia means enlargement of the thyroid gland. Worldwide, over 90% cases of goiter are caused by iodine deficiency. Main reason behind the goiter is iodine deficiency, and worldwide 90% cases of goiter are caused by the deficiency of iodine. It may be associated with hypothyroidism. It may be associated with both hypothyroidism and hyperthyroidism. Goiter condition may be associated with both hypothyroidism and hyperthyroidism. Hypo and hyperthyroidism are associated with the goiter, maybe. Sign and symptoms. Sign and symptoms of goiter. For hyperthyroidism, in which hyperthyroidism sign and symptoms are like tachycardia, palpitations, nervousness, tremors, increased blood pressures, heat intolerance. These are the sign and symptoms of goiter under the hyperthyroidism. Like tachycardia means increase the heart rate, palpitations, nervousness, tremors, increased BP means tachycardia, heat intolerance. These are the sign and symptoms of goiter. For hypothyroidism, sign and symptoms for hypothyroidism like weight gain, despite poor appetite, cold intolerance, constipation, lethargy. But these symptoms are often non-specific and makes diagnosis difficult. Lethargy. Lethargy means characterized by laziness and loss of energy, also known as lethargy. These are the signs and symptoms of for hypothyroidism. Classification of goiter. Classification of goiter. Classification of goiter. Growth pattern. First one, depend on the growth factor classify of goiter. First one, uno, uninodular goiter. Second one is multinodular goiter. Third one is diffuse goiter. These are the three types of goiters depend on the growth pattern. And second one depend on the size. Class first goiter, class second goiter, class third goiter. First of all, uninodular. Uninodular goiter. Uninodular goiter, that is a, that is single nodules and bumps on it. Uninodular means that has goiter that has single nodules on bumps on it. And second one is multinodular. Multinodular means goiter that has multiple nodules or bumps on it, also known as multinodular. And diffuse goiter. Diffuse goiter means is a autoimmune condition. Diffuse goiter is a autoimmune condition characterized by the diffusely hyperplastic thyroid gland with excessive overproduction of thyroid hormone. These are the growth. These are the classification of goiter according to growth pattern. First one is uninodular. Second one is multinodular, and third one is diffuse goiter, in which uninodular is single nodule and bumps on it, and multinodules or bumps on it, and diffuse goiter is a autoimmune condition characterized by difficulty hyperplastic thyroid gland with excessive overproduction of thyroid hormone. These are the types of goiter. And according to size, class first goiter, class second goiter, and class third goiter. These are the figures of goiter disease. Causes. First one causes of goiter like iodine deficiency. Second one causes congenital hypothyroidism. Third one causes pituitary disease. And fourth one causes thyroid cancer. And fifth one causes thyroid hormone insensitivity. These are the causes of goiter. Iodine deficiency. Iodine deficiency means low level of T3 and T4. And congenital hypothyroidism. Congenital hypothyroidism is a condition. Congenital hypothyroidism is a condition resulting from an absent or underdevelopment thyroid gland. Underdevelopment and absent of thyroid gland means this dysgenesis, also known as congenital hypothyroidism. And next one is thyroid cancer. Thyroid cancer means the butterfly shaped glands at the base of the neck, also known as thyroid cancer. Thyroid hormone insensitivity. Thyroid hormone insensitivity. Thyroid hormone insensitivity means Raft-Off syndrome is which thyroid hormone level elevated but thyroid stimulating hormone level is not suppressed or not completely suppressed, also known as thyroid hormone insensitivity. Treatment. Treatment of goiter. Treatment of goiter. It is treated according to cause. It is treated according to the cause. If thyroid gland is producing too much, if thyroid gland is producing too much T4 and T3 thyroid hormone. T4 means thyroxine and tetraiodothyronine, and T3 means triiodothyronine. And radioactive iodine is given to the patient to shrink the glands. And if the cause is iodine deficiency, if the cause is iodine deficiency, it is supplemented and Lugol solution of potassium iodide. These are the treatments of goiter. Graves' disease. Graves' disease, also known as toxic diffuse goiter. Graves' disease means also known as toxic diffuse goiter is an autoimmune disease. Is an autoimmune disease that affects the thyroid gland. In which Graves' disease, diffuse goiter, toxic diffuse goiter, autoimmune disease that affect the thyroid gland. And diffuse goiter means spread out over a large area. It is the most common cause of hyperthyroidism. Graves' disease is most common cause of hypothyroidism is Graves' disease. Hyperthyroidism is a most common cause of Graves' disease. The exact cause the disease. The exact cause of the disease in you unclear, and however it is believed to involve a combination of genetic and environmental factors. Genetic and environmental factors. Sign and symptoms of Graves' disease. Sign and symptoms of Graves' disease. Almost all of sign of the disease is believed to be a result of hyperthyroidism, and this includes insomnia. Insomnia means loss of sleepiness. Insomnia. Insomnia means insomnia means loss of sleepiness and hand tremors, hyperactivity, heat tolerance, excessive sweating, weight loss disputes increase, appetite, etc. And exceptions are ophthalmopathy, goiter, and peritibial myxoedema. These are the ophthalmopathy. Ophthalmopathy means is a autoimmune inflammatory disorders, and disorders orbit and preorbital tissues. These are the sign and symptoms of Graves' disease. Mechanism. Mechanism. Thyroid stimulating immunoglobulins recognize and bind to thyrotropin receptors. Thyrotropin receptors. Thyroid stimulating immunoglobulins recognize and bind to thyrotropin receptors, which further stimulates the release of T3 and T4. Further stimulation the release of T3 and T4. Thyroxine receptors in the pituitary gets activated by surplus hormones, suppressing further release of thyroid stimulating hormone in a negative feedback loop. Thyroid stimulating hormones. It is a primary found on the surface of the thyroid epithelial cells, but also found in adipose tissues and fibroblasts. This is the location of thyroid stimulating receptors. Next one, treatment of Graves' disease. Treatment of Graves' disease includes antithyroid drugs, which reduce the production of thyroid hormone by the inhibition of release of thyroid hormones. And radioiodines is also used as a measure. Radioiodines also used in the treatment of Graves' disease by the measure of and thyroid thyroidectomy. Thyroidectomy means surgical excision of gland. Thyroidectomy means surgical excision of gland is also used in many cases. Mild cases of ophthalmopathy could be treated by lubricant, eye drops, or non-steroidal anti-inflammatory drugs. Lubricant, eye drops, and Non-steroidal anti-inflammatory drugs could be treated in ophthalmopathy. Criticism. Criticism mostly found in children's. Criticism mostly Criticism disorder is mostly found in children's. Criticism is a condition. Criticism is a condition of several instant physical and mental growth due to untreated cognitive deficiency of thyroid hormone and usually due to maternal hypothyroidism. And maternal hypothyroidism means maternal hypothyroidism is a common cause of overactive thyroid in pregnant women. In Graves' disease, the disease occurs when your immune system become overactive and forms antibodies, immune proteins that attack the thyroid. They cause the gland to the enlarge and make too much thyroid hormone, also known as maternal hypothyroidism. Pathophysiology. Pathophysiology of criticism. Criticism can be endemic. Criticism can be endemic and cognitive deficiency. Cognitive deficiency, also known as immunodeficiency disorders, are characterized by a deficiency, absence, defect in one or more of the main component of the immune system, also known as cognitive deficiency. Pathophysiology. Pathophysiology of criticism. Criticism can be endemic. Criticism can be endemic, genetic, or sporadic. Endemic means particular peoples are or country, and pandemic means spread over multiple countries, and sporadic. Sporadic means occurring occasionally, singly, or in irregular or random instance. Sporadic prote- proteus and sporadic disease, also known as. And poor growth is apparent as early as the first year of life, and it causes mental deteriorations. It causes mental deteriorations and swelling of skin and loss of hair, and bone maturation and puberty is severe delayed. Bone maturation and puberty is severely delayed in the criticism. Puberty. Puberty means is the time of life when a boy or girl become sexually mature. Puberty means 10 to 14 years for girls and 12 to 16 years in boys. This is the puberty age. And ovulation is and infertility is common. Infertility is common means not getting pregnancy. This is the pathophysiology of criticism. Next one, cause and treatment. Cause and treatment. Most common cause is iodine deficiency. Most common cause is iodine deficiency. Most common cause is iodine deficiency, and population living in area with low soil iodine concentration are prone to this disease. Sporadic and genetic criticism. Sporadic and genetic criticism results from abnormal development or function of the fetal thyroid gland. Abnormal development or functions of the fetal thyroid gland. And this type of criticism has been almost completely eliminated in developed countries. Criticism has been almost completely eliminated in developed countries by early diagnosis, by newborn screening scams, followed by lifelong treatment with T4. tetraiodothyronine, and thyroxine. Frequent monitoring. Frequent monitoring every 2 to 3 weeks during the first month of life is recommended to ensure that infants with congenital hypothyroidism and remain within the high end of normal range. These are the cause and treatment of goiter, critism, and myxoedema. Myxoedema mostly found in elders. Myxoedema mostly found in elders and critism mostly found in children. Myxoedema is a term used synonymously with severe hypothyroidism, and myxoedema develops in the patient with almost total lack of thyroid hormone. It is generally characterized by vaginas under the eyes and swelling of the face. In this condition, generally increased quantities of hyaluronic acid and chondroitin sulfates bound with protein from excessive tissue in the intestinal space, and this caused the total quantity of interstitial fluid to increase. Because of the gel nature of excessive fluid, it is mainly immobile. Immobile means immobile means not moving, motionless, and the edema is the non-pitting type. Non-pitting type edema means the accumulation of excessive fluid in soft tissues and causing swelling, and non-pitting edema is usually leading into certain body parts such as the lower and upper limbs. Next one, causes of myxoedema. Myxoedema can occur hypothyroidism, hyperthyroidism associated with pretibial myxoedema and exophthalmos, and pretibial myxoedema can occur in 1 to 2% of patients with Graves' disease. A causes of hypothyroidism, and hypothyroidism including Hashimoto's disease, thyroiditis. Hashimoto thyroiditis means is in which one immune system attacks is one thyroid gland, above thyroid gland. Hashimoto thyroiditis is in which one immune system attack is above thyroid gland. Pathophysiology. Pathophysiology of myxoedema. Myxoedema cause a specific form of dermal edema. Myxoedema cause a specific form of dermal edema. Myxoedema is a form of dermal edema. Two connective fibers. Two connective fibers is separated by an increased amount of mucosaccharides. The connective fibers. The connective fibers is separated by an increased amount of mucosaccharides, and then these proteins mucosaccharides complex bind water and producing non-pitting foggy edema, non-pitting foggy edema, in particular around eyes, hands, and feet. Myxoedema particular around eyes, hands, and feet. Myxoedema is also responsible for thickening of tongue and laryngeal and pharyngeal mucous membrane. This is the pathophysiology of myxoedema. Treatment of myxoedema. First of all, airway management, thyroid hormone replacement, glucocorticoid therapy, supportive measurements. These are the treatment of myxoedema. Hashimoto's thyroiditis. Hashimoto's thyroiditis is a in which one immune system attacks is above thyroid gland. It is a autoimmune disease. Hashimoto's thyroiditis is a autoimmune disease in which the thyroid gland is gradually destroyed. In which Hashimoto disease, the thyroid gland is gradually destroyed. Over time, the the thyroid may enlarge and form painless goiter. Hashimoto disease cause the enlarge and form painless goiter. Some people eventually develop hypothyroidism. Some people eventually develop hypothyroidism. After many years, the thyroid shrinks in size. After many years, Hashimoto's disease, the thyroid shrinks in the size. It is thought to be caused due to a combination of genetic and environmental factor. Due to Hashimoto's disease was due to combination of genetic and environmental factors. Sign and symptoms. Sign and symptoms of Hashimoto's thyroiditis. First of all, fatigue, weight gain, pale and puffy face, pale and puffy face, feeling scored, joints and muscles pain, constipations, dry and thinning hairs, irregular menstrual cycles, depression, etc. These are the sign and symptoms of Hashimoto thyroiditis. Pathophysiology. Pathophysiology of Hashimoto's thyroiditis. Various autoantibodies. Various autoantibodies may be present against thyroid peroxidase and thyroglobulin A and thyroid stimulating receptors. Auto, Autoantibodies may be present against thyroid peroxidase and thyroglobulin and thyroid stimulating receptor. Thyroid peroxidase. Thyroid peroxidase is an enzyme normally found in the thyroid gland, and thyroid peroxidase play an important role in the production of thyroid hormone and thyroglobulin. Thyroglobulin is a protein found in thyroid gland, and gross morphological changes. Gross morphological changes. Gross morphological changes within the thyroid are seen in the journal enlargement, which is far locally nodular and irregular than more diffuse patterns. This is the pathophysiology of Hashimoto thyroiditis. Treatments. Treatment of Hashimoto thyroiditis. Managing hormone levels. Managing hormone levels. How to manage hormone levels? Hypothyroidism. Hypothyroidism caused by Hashimoto's thyroiditis is treated with thyroid hormone replacement agents like levothyroxine, triiodothyronine. Hypothyroidism means in which condition thyroid gland doesn't produce enough thyroid hormone, also known as hypothyroidism. These are the treatment of Hashimoto disease like levothyroxine and thyro, thyroid, triiodothyronine. Hashimoto disease. Hashimoto disease in which Hashimoto disease enlarged and inflamed underactive thyroid means goiter. These are the references like clinical pharmacy 10th edition 2010 by P.N. Bennett and clinical pharmacy and therapeutics 5 September 2011 by Roger Walker and Kate Viteslasia, and third one reference is pharmacotherapy, a pathophysiological approaches, Repro 7th editions, and essential of medical pharmacology, Kate Tripathi 5th editions, basic and clinical pharmacology, Peterman Gates Jones 11th edition, Regendale pharmacology 6th editions, and Pharmacology and pharmacotherapeutics. Therapeutics, RS Sotakar 20 edition. These are the references for thyroid disorders and thyroid disease. Multiple choice questions. MCQs. MCQs means multiple choice questions. First one question. First one question. The most common thyroid disorder is the most common thyroid disorder is option A is hypothyroidism, option B is radial thyroiditis, option C is hyperthyroidism, and option D is thyrocellular. The right answer is A, hypothyroidism. Next one question. Hypothyroidism caused by Hashimoto-thyroiditis is much more common in women than in men. The right answer option A is true, option B is false. The right answer is A, true. One of the one of the symptoms of hypothyroidism is one of the symptom of hypothyroidism is option A is fatigue, option B is intolerance to cold, option C is weight gain, and option D is all of the above. The right answer is D for hypothyroidism is the option D is all of the above. And like fatigue, intolerance to cold, weight gain. These are the symptoms of hypothyroidism. And next one question. These symptoms of hypothyroidism may be difficult to detect. Symptoms of hypothyroidism may be difficult to detect. So the condition can best be diagnosed with option A is an MRI scan, option B is an ultrasound, option C is a thyroid stimulating hormone TSH, and option D is a hemoglobin test or hematocrit test. The right answer is C, a thyroid stimulating hormone test. Next one question. A person with untreated hypothyroidism. A person with untreated hypothyroidism may also have option A is high cholesterol, option B is low blood pressure, option C is low blood sugar, and option D is none of the above. The right answer is A, high cholesterol with untreated hypothyroidism may also have high cholesterol. And next one question. In women, hypothyroidism can affect pregnancy by option A is reducing the chance of getting pregnant, option B is boosting the chance of getting pregnant, option C is making miscarriage more likely, option D is making labor and delivery more difficult. The option answer, the right answer is A, reducing the chance of getting pregnant. Next one question. How is hypothyroidism treated? How is hypothyroidism treated? With radiation, option B is with surgery, option C is with a synthetic hormone, option D is the condition can't be treated. The right answer is C, with a synthetic hormone. Next one question. Where is the thyroid gland located? Where is the thyroid gland located? Option A is at the base of the spine. Option B is in the abdomen. Option C is in the neck. Option D is in the brain. The right answer is C. Option C C. In the neck. In the neck, thyroid gland is located. The thyroid produce hormone. The thyroid produce hormone that regulate what body functions, bodily functions. Option A is metabolism. Option B is temperature. Option C is blood pressure. Option D is digestion. The right answer is A. Thyroid produce hormone that regulate by body metabolism. Next one question. Weight loss, rapid heart rate, and heat sensitivity are likely symptoms of. Option A is hypothyroidism, underactive thyroid. Option B is hyperthyroidism, means overactive thyroid. Option C is thyroid cancer. Option D is all of the above. The right answer is B. Hyperthyroidism and overactive thyroid cause the weight loss, rapid heart rate, and hypersensitivity. These are the multiple choice questions for thyroid disorder and thyroid gland. These are the thyroid disorders. The thyroid produce hormone that regulate what body functions. Option A is metabolism, option B is temperature, and option C is blood pressure, and option D is digestion. The right answer is metabolism. And next one question, weight loss, rapid heart rate, and heat sensitivity are likely symptoms of. Option A is hypothyroidism, underactive thyroid. Option B is hyperthyroidism, overactive thyroid. And option C is thyroid cancer. And option D is all of the above. The right answer is hyperthyroidism, overactive thyroid. Thank you. Thank you all of you for a wonderful session.